Hi, I'm Dr. Paulina Villa, and I'm the Medical Director of Medical Air Service.
Join Dr. Paulina Villa as she breaks down our assessment process and the steps we take to ensure safe medical transport for every patient. What are the first things you look at to make sure a patient can be transported safely?
We start the process of planning a patient's flight by first having a quick assessment of what the person that's calling us knows about the patient. If that is not enough for us to decide what's the best form of transport or how can we help, then we will ask to get in touch with either the medical professional involved or documentation of how is the patient actually doing. When we talk about the basic information that we need from the client is where the patient is at. If the patient is in a hospital, nursing home, or house. We need to know if they know the information, if the patient is conscious or not, can the patient walk, does the patient need assistance for mobility, or does the patient need oxygen? That's the most basic stuff that we need from the family members.
What does fit to fly mean? How do you make sure a patient is safe for transport?
One important thing that you need to know about us is that we're always gonna look for the best and safest way to transfer. We do not want to jeopardize the security and the health of the patient during the transport. The fit to flight is really the assessment that we have to ensure the safety during the transport. The fit to flight is a document that is going to help us know what equipment is required and to plan for any possible complications and risks.
Air ambulance or medical escort? How do you choose the safest transport option?
An air ambulance is needed when the care of the patient is either intermediate or ICU care. This helps us have all the equipment available in case of any emergencies during the transport. An air ambulance is prepared and has everything aboard like a hospital ICU. That includes basic stuff like oxygen tanks, advanced monitoring, 12-lead monitoring, suction devices, ventilator devices. A medical escort flight is sufficient when the complications that we are prepping for are basic and they do not need all the equipment of an ICU care. If the patient can stand or if the patient can withstand takeoff and landing, then we will assess and try to get a medical escort. Doing a medical escort mission, the professional that's going to be by your side has everything they need for an emergency.
How do you decide which type of medical professional accompanies the patient?
The special training that all professionals that are involved in this require is knowledge on critical care transport. That involves knowing how to solve emergencies either in ground or by air. That also includes knowledge about aircrafts and includes knowledge about physiology when you're in an aircraft, which is basically knowing what the body is going to go through if they go into an airplane. So no matter what professional is with you, they're all equipped for an emergency. It depends on the level of care you need and what's going on. But in each case, we can either provide a nurse, a paramedic, or a doctor. Sometimes you need all three of them, but they all know how to act in transport.
How does medical air service manage every point of a patient's journey?
There's a lot of people involved. So we're gonna help coordinate everything for you. We're gonna coordinate with the doctor or with the facility that the patient's at. We're gonna coordinate with the airport and we're gonna coordinate everything with the other side. So every point and detail is taken care of by us.
Start your safe medical transport with Medical Air Service.
Thanks to our evaluation, fitness to flight checks, highly trained medical professional, careful equipment preparation, we're able to deliver safe and reliable medical transport anywhere in the world.